Good afternoon, everybody. We're just letting you all into the meeting and then we'll start. Okay, we are recording the meeting for people who can't join us today. So if you don't wish to be seen or heard, keep your camera off and your microphone muted. Be time for questions at the end as usual. And if you've got any other questions, put them in the chat. We're joined by Nadia, Jane and Michelle, who are the experts in all things COVID related, and Dawn, Jess, myself are here, Sandra from the IDS team, and a number of other LA officers to try and help out as well. So I've got some queries to respond to at the end of the session. I'm not going to waste any more time. I'm going to hand over to Nadia and she's going to give you the updates and respond to some queries that have been coming in over the last week. It's certainly been busy.
Thanks ever so much, Amanda. And just to say, we've also got two new members of our team here today, just to come and listen in, Ripon and Sharon. So you may well meet Ripon and Sharon at some point as well. But I know that you do know Michelle and probably Sam as well from our team. Yeah, we know it's been really busy for yourselves. I think it is, this is mirrored just not just obviously in Warwickshire. We're seeing it in Coventry and nationally at the moment. We know that case rates are really high or escalating in our 0 to 9-year-old age group. So I'm just going to share with you the chart of where we're up to in terms of the districts and boroughs in Warwickshire. So hopefully you can see this screen. And it's a bit misleading, this chart, because, yeah, I know, actually there is 0. You can see 0. There is 0 on the chart there. But we've had this very, very large spike here linked with the Omicron wave. And case rates have come down. But in Stratford and Warwick in particular, if you can see the colour key on the right-hand side, are starting to increase, whilst other districts and boroughs have seen plateaued rates. What this doesn't show you is how things are playing out in terms of different age groups, and we are seeing persistent increases, unfortunately, at the moment in the 0 to 9 year age band, and again in the 30 to 39 year age band, that kind of parental age, probably some of the age of some of your staff as well. So we know it is really, really hard at the moment in earlier settings. Not only earlier settings though, but also primary schools, I think, are seeing, a lot of spread currently, and I know it is very, very tricky to manage. So I think at the moment, we know that you've got all of our principles documents, where the where all the advice is on the website, and I think we're going to try and make sure everything is up to date on the website, because I think as things change, we're having to change the guidance and re-upload that, but we do want to make sure that you've got the latest guidance available for you. But we thought today we might just go through a few of the key principles and things to remember, and just to rehearse, firstly about how to try and prevent COVID in your setting, but then also how you respond if you do have COVID in the setting. So in terms of some of the basic principles, and we know that we feel like we've been doing this for a long time now, sort of 2 years, but going back to the key principles, it is really important that you keep up your cleaning in your setting, and that you do deep cleans when you do get cases. So and it is just elbow grease cleaning. You don't really need any fancy fogging machines. We know that there are lots of products on the market that will sell, but you do need a detergent clean followed by a disinfectant clean, or you can get combined products. The key thing, so you get detergent and disinfectant together. The key thing is the disinfectant either has to have 1,000 parts per million chlorine, or it has to meet a standard called the EN 14476 standard. And that should all be on the flow charts that we send you, the PowerPoint slide as well. And as long as you've got those, we know that they kill COVID. So please do make sure you have a deep clean. Do your touch points really regularly as well. Door handles, light switches, sinks in the toilets, toilet flushes, that sort of thing as well, really important. Keep up with hand hygiene, both for your staff and your children as they're coming in. Soap and water is is the key, really. Hand sanitizer is great, but you have to have clean hands in the first place to be using hand sanitizer effectively as well. Think about how you can minimize mixing when you do get cases. So it's about thinking about your staff breaks. Do they take breaks alone? If you can get them to take breaks alone, please do. Can you cohort staff to particular rooms and not mix staff or use them across settings? We know that's really challenging, particularly when you've got staff off who are unwell, but as much as possible, reducing that mixing will really help in terms of prevention as well as responding to cases as well. There's a few other questions that I know Sonia has raised with me that I'll go through before we talk through some of the other bits. The other thing is that anyone with COVID, any of the top 3 COVID symptoms, should be at home and having a PCR test. So just to remind you that anyone who's got any of the top 3 COVID symptoms should have a PCR test. LFT tests are for people without symptoms. Broadly speaking. We also know that when COVID is circulating, there are other symptoms as well as the big 3, which are cough, high temperature, and loss or change in taste and smell. There are other symptoms as well to be mindful of when COVID is circulating. So those are headache, sore throat, feeling fatigued, muscle ache, sometimes in little children, diarrhea and vomiting, and other cold-like symptoms are presenting at the moment. So it's just being mindful and really, even where children don't have COVID and their tests negative, if they're not well, they should be at home. And that goes for staff as well. In terms of if you do start seeing COVID cases, when does it become an outbreak? The technical definition of outbreak has never changed, and that is always 2 or more linked cases. And the way you can tell whether they're linked or not is usually just through a bit of detective work. If you know of a good reason outside of your setting why somebody's positive, then usually would say, unless you've got any reason to believe there is something else going on in the setting, we'd usually call that a cluster. So if you've got, for example, a member of staff who says, well, my husband was positive first and now I've tested positive, and another member of staff that works in a completely different room and they've got an external reason, we'd probably call that a cluster. But in the absence of any really good evidence from externally, we'd say think of it as an outbreak in your setting, and make sure, it's about having these things in place, that the things that I've talked about to begin with, to try and prevent it. But then when you do start seeing cases, to immediately get on to thinking about, right, I need my symptomatic people at home, they need to be PCR tested. You then think about close contacts. So as you know, the national guidance says for under 5s you don't need to isolate and you don't need to test unless you're a household contact, in which case a PCR is recommended. Locally, we do recommend all close contacts have a PCR test and any LFT testing that parents are happy to do. We know that parents may not be happy to test under 5s, and that's absolutely fine. We just think it can be helpful to test, because actually if you're identifying positives, you can get them out of the settings, setting earlier, so that you get less spread overall. I know there's somebody's hands shot up, but we will come to questions. In terms of whether you need to close a room or close a whole setting, we were previously working on thresholds with schools and with early year settings, where we'd say, okay, maybe you need a bit of a fire break of a few days whilst close contacts go and get a PCR and then come back again. We haven't really been working since Omicron, because of the transmissibility of it. We haven't quite been working in that way. So really, we've said that for special schools, we are sometimes doing fire breaks. For other school settings and early year settings, really, if you have got significant concerns about your setting or you've got staffing capacity issues, it may be that a fire break is what you need, because you need to safely run the setting. And if you do need to close a bubble, then you need to close the bubble. If you need to close the whole setting, then you need to close the whole setting. Generally speaking, though, to reduce transmission, we haven't been using a particular threshold above which you would. It's really about how it overall it's feeling for you as a setting, and whether you can run the place safely. So And as you know, you are responsible for health and safety in your own setting. So we do understand where you actually, you know, when you do have concerns, you're the ones that know your setting the best. There's just a reminder that childminders who have got household members who are positive can't work from home, and there is some separate guidance that I'm sure is on the early years website as well, because I think I've seen it, that talks through the options if you do have somebody in the household who's positive as well. LFTs versus PCR. As I say, PCRs for symptoms, LFTs for people without symptoms. Close contacts we've talked about in terms of what the national guidance says, which is that they don't need to test or isolate if they're under 5, but we recommend a PCR test and any LFT testing that they're able to do. In terms of the adults, though, if a staff member or adult who's been in close contact is doubly vaccinated, they don't need to necessarily isolate. But they should take daily LFTs for 7 days before coming into the setting. If they're not doubly vaccinated, I'm afraid it's isolation for 10 days, and that is a legal requirement. So that's the situation with adult close contacts. One additional thing that we recommend when you have an outbreak and you're dealing with multiple cases is that you may want to ask parents of children where there's a positive case in the household, ask them to stay off until they've had a PCR result. We know, again, that is something that is local, that's our local guidance that the National Contingency Framework allows us to have when you're in an outbreak mode. So that's another thing that can sometimes be helpful. For settings, it's probably particularly helpful for schools as well, where you've got multiple siblings in different year groups as well. In terms of, there was another question around catering staff, because I think some settings have had cases in catering staff. And one of the things I was going to say there is that depending on how your setting runs, if you can try and minimise the contact of any staff with any children, really, or with each other, then that's a good thing to do. So if you can get catering staff to almost be behind a counter to make sure the food is prepared, but then staff in the rooms who are working with those children to give out the food, then actually you've minimised that risk of potential transmission, especially if you've got catering staff who have to go into every room, because if any of them test positive, you've generated potentially close contacts. If they do have to give out food, it's just trying to make that contact as transient as possible, you know, just and if preferably behind a screen if you have that sort of thing available, but if not, so just making that as transient as possible. In terms of face coverings, you'll have heard that as of the 27th, face coverings in communal areas and while staff are circulating won't be required anymore. However, again, according to the National Contingency Framework, when you have multiple cases or an outbreak, we are recommending that staff do that. It's just an additional protective measure to try and reduce spread within the setting. Ventilation is really important. And we know it can be difficult when kiddies get cold, but anything you can do, you don't necessarily have to have windows wide open. If you can vent, if you can put windows on vent, any air circulation and getting fresh air from the outside can really help reduce transmission. But we do say this for care settings as well. If you can open the windows for 10 minutes every hour, you'd have to time it and make sure you were doing it. That can even be beneficial if that's something that you think would work better for your setting. Vaccination, I can't stress it enough. It's so important that all staff, and I know some people do have very strong views on this, that all staff have their 3rd dose of vaccine, because 2 doses isn't enough to protect them against serious illness, and we know that, and we've seen, you know, recently within education, actually in the sub-region, we have seen some young people pass away. So I think it is really important to really stress to staff that having that 3rd dose is really important. I know that a lot of you will be having those conversations, and it can be really challenging, but there's lots and lots of places still vaccinating, GP surgeries, community pharmacies, etc. As well. So I think I've probably said enough. And I know that there are probably some questions now, so I don't know if there's questions in the chat, but I know somebody's got their hands up as well. So yeah, let me have a little look at the chat. Michelle might want to come in as well if there's anything you think that would be really useful to cover.
It was oh, hi Nadia. Yeah, it was just to say, because obviously spoken to a lot of early year settings this month really. It was just to say, when we're dealing with outbreaks, is I know it can be sometimes difficult, but just try to zone the staff as well as the children, because the staff moving from one room to another, it tends to happen when you're in an outbreak situation, because you've got a situation where you haven't got enough staff, so you're actually increasing the risk of COVID. So just wherever you possibly can, just really consider zoning those staff to help with the transmission. That's just something that I've noticed when speaking to settings, so I just thought I'd mention it. Something so simple, but it's so easy to forget when you're in the thick of it all.
Yeah, and I think that's a really important point. And the other thing that we have sort of picked up, some settings tend to have managers that might open the door to all the children, but if it's possible to keep the staff from the rooms that they're in, greeting the children, etc., then that's also a really good thing as well. The only other thing that's come up recently is toilets and different rooms sharing toilets, and if there is a way in which, and I know it's really difficult in settings, but to try and stagger the toilet use, or just make sure that it doesn't become a bit of a hot hub for mixing of children. And that's another thing I would say is something that's come onto our agenda recently in a school setting actually. But there's a few things in the chat in terms of face coverings. I'm actually not sure where early years colleagues can get access to PPE. Is there the national portal? Early years colleagues might want to come in on that one. In terms of pickups and drop-offs, I can see Amanda has responded to that you're quite within your right to ask them to wear masks on pickup and drop-off, and I think it is just it's about the relationship you've got with your parents. I know it's not something that's mandatory, but it's nice and it's respectful. What's the appropriate temperature? Good question, and I don't know that, but I'm sure there is some guidance around that from a health and safety perspective in terms of minimum temperatures. Amanda, I don't know. Yeah.
There's no set temperature specifically, because if you're a physical worker, it's different to if you're sedentary. But for buildings, it's a reasonable temperature is generally thought to be no lower than 16 degrees and no lower than 13 degrees for physical work. But it depends on what you're doing. So in a baby room with non-mobile babies, the temperature would need to be higher than it would need to be for your 3 and 4 year olds who are active and are able to move if they're cold, whereas a non-mobile baby wouldn't be able to tell you they were cold and they wouldn't be able to move. So it's a case of going back to saying to yourself, what's it like to be a child here? And especially for your non-mobile children, to actually get down on the floor and see if there is a draft blowing all over them.
Yeah, no, absolutely. So thank you for that one, Amanda. In terms of parents still don't, I know, and it is tricky. It's impossible not to mix stuff. And as I say, I definitely know that that's a real challenge when you've got everybody off with COVID, so understand that. Some Banana Moon said, I'm so short-staffed, I have to move children around. Yeah, I know. And this is all a balance, isn't it? It's about doing the best that you can. Only way to stay sustainable. Luckily, only 2 cases ever. I really hope that stays the same way for you. I'm touching everything here, Banana Moon. Sorry, Amanda, you have come back to the. So tell us again how you're defining an outbreak. I'm interested, Rachel. What does it make a difference to you? I'm just interested because a lot of people ask us this question. I'm just wondering where it comes from in terms of. So it's 2 or more linked cases, but how does it? I don't know if you can come in there.
It's because I think that then you instigate your outbreak management.
Yeah. Okay, yeah, so two
and we're very well behaved, Nadia, in early years, and we like to implement our plans at the right time.
At the right time, is that what it is? Yeah,
it is. Well, if their brains work the way mine does, it's time to get a different plan off the wall, and I want to get it off the wall at the right time.
And I think it's hard, isn't it? Because yes, you could wait until you have two or more cases before you think about all these things. But actually, even better, could you think about them all up front so that either they're ready to go when you get an outbreak, or actually you're trying to prevent it in the first place. But yeah, it's two or more linked cases. Definitely a battle between ratios and transmission risk. Yeah. And understand, so it is really tricky.
Yeah, I think sometimes you can carry on trying to do the best for everybody and say, I'll put this person here, I'll put this person here, and then you end up with it just going from one room to the other because you've tried to be so flexible to keep everything open.
Yeah,
especially with this variant because it's so transmissible.
It really is, and it is. It really is, and I know that you're having a really hard time. And I think early years colleagues were saying you were telling me how many emails you've had in the last month.
Yes, 3 of us have been through 1,700 emails in January.
Yeah, it's a lot.
So the plea from me is, please write on the end of your emails, yes, we have followed steps 2 and 3. Because I'm sure you must be really fed up with us emailing you back saying, have you followed steps 2 and 3?
Yeah.
So if you're fed up with that email from us, just put in capital letters if you like. We've followed steps 2 and 3.
No. Brilliant, thank you.
1,700 emails in one month.
Yeah.
So.
And I think there's a couple of colleagues with hands up. I don't know whether we go there. I'm mindful. I may need to drop off at 2 to go and talk to head teachers, but I get too carried away in this session. Claire, do you want to come in? And then somebody from Weddington Preschool, is it? Claire?
Hi. Yeah, I can vouch. I haven't spoken to Amanda, but Sonia's been absolutely amazing this week. The trouble that I'm finding is that the NHS test and trace.
Yeah.
They are texting the parents for the close contact and saying on that message, children under 5 do not need daily rapid tests. They don't need to do anything, basically, without reading it all out. Now, we've got the local guidance, but it's guidance. And parents that have read up and are saying, no, I do not need to do anything. I've got this text message from and to be fair, I'm a parent. I've got that. Yep. Okay. I've done everything that I should be doing. I'm a great parent, But that leaves us extremely vulnerable and looking a bit daft. Well, we were told by Warwickshire, I've been on this webinar, you've told us to do this.
Yeah.
And then how do we say to one parent, okay, that's fine. You're clearly not going to do it.
Yeah. Yeah,
Claire. But another parent who goes out their way to PCR and make us safe. So where do we stand? Because it's not worth the paper I'm writing on. We've done our outbreak plans, but they've changed that many times in the last 2 weeks. Not your fault at all, but we're just a bit stuck with giving the right information at the right time.
I think it's the way you phrase it, really, isn't it? So, and I like you have dealt with lots of parents who want to do what they want to do, and that's up to them. So when they're saying, I don't have to do this and I don't have to do this and I don't have to do this, I'd say to them, no, absolutely you don't. You don't have to do any of it. But what we're trying to do at our nursery is to keep every single case to a minimum, because every time we have a case, that means that it takes longer to get the nursery clear from COVID, and every time that we can't get the nursery clear from COVID, it means that we're not able to focus on teaching and learning, and that's what we're here for. So everything we can do to minimise COVID-19 in our setting. Every step we can take, that's what we're going to do. And then I just smile sweetly and wander off.
Yeah, there you
Would
go.
you like me
I
to
love that,
come and
Amanda.
stand on the door?
I think that would be good, Amanda. I mean, Claire, yeah, I won't really add
To
more.
be fair, that's what we have been doing.
Yeah.
If
Keep
I
doing
can't
it.
get through
Broken record. Just broken
legislation,
record. Smile
yeah,
sweetly.
full
We
on
are
hard
doing
steps.
this for the good of the children.
Yeah.
We know we don't have to, but, you know, when this has been going on for 2 years now, every single step we can take, we are prepared to take.
Yeah.
And Claire, just on that, just so you know that when parents book a PCR, they can tick that box that says my local authority has asked me to have a test, so they don't have to tick any box that says they've got symptoms or anything like that. If they're a close contact, because it's on our instruction and it is our local guidance. I appreciate it, and I think whatever we do, we get complaints, you know. So if we weren't to do any tests or recommend any testing, we'd get parents saying, well, what are you doing in this setting? There's been, you know, do you know? So it's really tricky, isn't it? But yeah, I won't say any more.
I mean, the other thing that you can say this week is, oh, you know, goodness me, I think 16 settings have been fully closed this week, which in the grand scheme of how many settings there are in Warwickshire is tiny. But, you know, we don't want full closures. So if we're to prevent full closures of settings, again, we've got to take, you know, extra steps. And the numbers in Warwickshire are high at the moment. So, no, we could all say, we're just going to live with this. We're not going to take any additional steps, but numbers would be even higher because look at how high they are with everything you are doing. And you couldn't do any more.
No.
You know, you're all working so hard. And, you know, I take my hat off to you every single day. You get up, you go out there and you deal with it. So, you know, don't give up. Just put your eyes and teeth smile on. Smile sweetly, broken record. You can do it.
I'm just mindful, I've got Weddington and Celia here. I definitely want to answer questions if I can and then pop onto the head teacher's call. Is that all right? Weddington preschool, is there?
Hi there. Yeah, mine's more just I don't know if anybody else has found this, but with children getting it in within families that are PCRing as soon as their family members are getting LFTs, and this isn't just the children, so it's not affected our setting, but they're getting negative PCRs, and a lot of them, their symptoms or testing positive 8-9 days after. So we're not actually getting many that are getting it within families that are showing under 7 days. So they're doing the PCRs, they're doing the LFTs, so the families are carrying on as normal. And then all of a sudden, day 8 or 9, which would have made sense to stay at the 10 days. So they have carried on mixing. So actually, it's knocking some of our families out for 5-6 weeks because it's a knock on every 8 days of them. They've got another family member that is testing positive because it's not actually happening as early as the PCR. Having a PCR,
that's interesting.
Within 2 days, it's showing negative, and according to all the guidance, you can then carry on functioning. They're carrying LFTs for 7 days, and then all of a sudden, day 8 or day 9, they're getting a sore throat, testing, and then they're positive. It's just something we found within our area.
That's interesting.
And even within my own family, that's we're on week 5. My daughter started it from New Year, and it's day 8 or 9, only because we're testing because of children at school and our jobs.
That's
so
interesting.
Know if that's happening anywhere else, really.
I'm interested actually to hear if you post in the chat if there's anyone else experiencing that. Because technically it should be a shorter incubation period on average, so that is
which is why we were shocked, really. Actually, obviously the 10 days was better. I know that was a nightmare for a lot of families, but actually people are carrying on and it's spreading. I just don't know how that is going to change with everything that we're doing. I think it'll be around for a long time. But that was all just to let you know that's what we found.
Thank you. I'll definitely keep my ears out, and if anybody else has had that experience, it's interesting that. And obviously then the PCR doesn't work then, does it? Thank you. And then Celia, sorry, really.
Right, hello.
Hello.
Oh, hello, sorry. Yeah, well, so I'm quite nearish, Natalie. It's Celia from Knick Knack Preschool, and I've been speaking to Michelle a lot, which has been very helpful. But I'd like to say we have definitely had an outbreak, because we've had 6 members of staff and 15 children. And I found that it's like 5 days, you go back 2. Well, that isn't the case. It's 5 days that they're being contagious from. They are going for PCRs, and I've had to get parents to test on the door. It's not that we've not got good relationships with our parents. What it is that they can't test the children because the children don't want to be tested, and it's quite stressful for the parents. But I have found 2 children that were positive from doing it actually in the foyer, because we had such an outbreak. I had to do something quickly to sort of like stop it. So I think we need to know that it's not 2 days before it's 5. It's going to 5 now before this Omicron variant. We haven't had it in our setting before, previous to this, but it has been really bad, and the staff are coming back. Like you say, it's affected like the 30 to 39-year-olds. I've had 2 members of staff in that age bracket. One of them is fully boosted with the booster as well, and the other lady has got the 2 vaccinations. But it has affected them, even though they've both had it before. They've had the other variant. I just think you need to know. I don't know how much is said, but the reporting I found very hard, I must say, because we were down to 4 staff last week, and it was very hard to keep the place going, but I was determined to keep going. But it was really very hard to keep everybody safe. We did have less numbers because we'd got so many children with it, but it's like the school now. I feel we've got school children, we've got siblings of school children, and I think that's a bit of our problem as well. Like school children are getting positive, which is a knock-on effect on our children. I don't know what the cases like are in the school, but it seems as though
I think the schools, if it's primary schools, they are having a hard time. And no, it sounds like and Michelle has been keeping us up to date about Knick Knack, so well done for everything that you've done, because I think it is really stressful. Like you say, with no staff and knowing who's off and who's in, and keeping things going, so well done. Hadn't heard about the sort of 5 days before. It's generally been the 2 days before that's still quoted, but again, I'll keep that in mind.
Tracking on what our children have been. It's not, you think you're 2 days safe, but we're not with 5. I've only got 1 member of staff that's never had it now, and there's only 3 of us that haven't had this new variant, which is quite frightening, really. And I know you're not so poorly and everything, but it is still quite frightening.
No, absolutely. I know. I'm really sorry. I'm going to have to leave you there, but thanks very much. And I mean, you're doing a grand job, so please do keep going. Please do keep going. All right. See you soon. Bye.
That's lovely. Thank you, everybody. The only other reminder from me jotted down really is to just make sure that when you've got staff off, you've still got somebody with Pediatric First Aid. I know that the DFE made an announcement about coronavirus and being an exceptional circumstance, but the disapplications that we had last year are not in play. So our interpretation of that is that we do still need to have Pediatric First Aid, designated safeguarding lead, and those requirements in place. So, sometimes the decision making is made for you if you haven't got that kind of cover in place, and then you haven't got any choice but to head towards a partial closure. I'm just going to have a quick look and see if there are any more questions that we haven't responded to. Okay, I don't think there are. Is there anything else that anybody needs to raise today? Nope, can't see any hands gone up. Okay, thank you for your time again today. I know you keep coming to these, so I presume that they're still helpful for you. You know where to find us at the end of the inbox. And also, if you're having a really horrendous day and you just need a bit of emotional or moral support, we're all here to help you. Hope the rest of the week is calm for you, and we'll be here on this call again in a fortnight. Take care, everybody. Bye-bye.